I think in the last years we really had made a lot of progress in the treatment of HCC, and we have tried to summarize all these changes in the current ESMO guidelines, which has been published just a few weeks ago. And first of all, we do have now a couple of trials for local therapies, specifically for SIRT Y-90, which gave us an indication that this treatment is not a good substitute or rescue treatment for patients that have progressed on local therapies such as TACE. So we have 3 trials that were negative in these settings, and in the future we will need to be more careful on selecting of patients where we will apply SIRT or Y-90. And in contrast, in respect to systemic therapies, for many years we just had one drug available, sorafenib, which was approved in 2008. And then there were a lot of negative trials, phase 3 trials in first line and second line, and there was no progress made over 10 years. And now in the last 2 years, we have 6 more drugs with positive data in either phase 1-2, but also positive phase 3 data. So I think there's a great change in the future with more options for systemic therapy, which would allow the sequential treatment of patients with HCC. So immunotherapies are also very interesting in HCC. So we have seen a great success in many other solid tumors, and in HCC we have now seen a couple of phase 1-2 studies which indicate that HCC is also a good tumor in which we can apply immunotherapy. So we have data in first-line treatment from nivolumab with more than 100 patients, which kind of indicate that we have a median overall survival which was astonishing of 28 months. Just today we saw data from China with a new drug, anti-PD-L1 antibody in a Chinese patient population, which was second line, with a median overall survival of around 15 months, which is very much in line with the data we have seen for Nivo and Pembro in second line, which has been published in Western populations in the past. So I think we do not yet have phase 3 evidence. We have now comparison immunotherapy against standard of care. But based on the data we have seen in these monoarm, in these non-randomized studies, I think we have a very strong signal that immunotherapy is effective in a good proportion of patients with HCC in first line and second line.